very much. I'm asking Dr. Ronald Balassanian to join us. He is a pathologist with an interest in this topic and will be able to provide some comments on the, yes, please sit here. Thanks. And at this point, we want to have a discussion about these issues, and I would ask Brett to just give a brief summary. You don't have to stand. You can sit right there with the microphone and simply tell people about your experience and your what you're trying to do now through the law.
Okay. My name is Brad Bocook, and I am, we're talking about the tip of the iceberg, and I am the tip of the iceberg. I've used a cell phone to the best of my computation ability about 1 million minutes, which you'd be surprised how fast I can accumulate when you're in business and you're single, dating women, and doing business, okay? And that's 5,000 minutes a month for 15 years. It's somewhere around 1 million minutes, or 20 years. And I was an early adopter of cell phones because I was in commercial real estate, and I started in 1988, right when they came out. And I was real proud of the fact that I had a cell phone, and didn't realize I was actually a guinea pig, as well as the rest of society is right now. And I didn't sign an acknowledgement of that, nor has anyone else who's used a cell phone, that we're all guinea pigs, basically, in society. And this is probably the biggest it is the biggest human experiment in the history of the world, because it's never been possible to have so many people all doing the same thing across the globe. So I've used to be an athlete and very focused on health. And I'm actually a very good indicator of where this is all going, because I was so healthy, I didn't have any bad habits. As a matter of fact, I was known as really a health freak in my fraternity. I didn't drink, and probably was the only guy ever in the fraternity ever who didn't drink. And I've always really watched what I ate, and I've been, heavily focused on health. And all my friends used to joke about how much of a health freak I was. And for me, and not only was I very healthy, but I was also very aware of the news and very aware of dangers, and focused on, I read like 3 or 4 papers a day, and have since I was in high school, or at least peruse them. And I never caught any.
I just want to ask you to talk about the lawsuit that's moving forward now, and your view of the burden, because one of the things we keep hearing about is we need more research. Well, I've been in this business for about 40 years, and saying we need more research is like saying we don't need to do anything. Unless you say we need more research and we need to take steps to protect our children now. And I think that's kind of where the question really has to be a policy question. Frank, you had no idea of these things when you were running Microsoft. You obviously, didn't. And so the question is, what's the evidence, and what is the evidence you're bringing to bear now in your own lawsuit? And just tell people that there are lawsuits.
Okay.
They don't know that.
Well, once I got sick, and I had 2 near-death experiences where I actually died a couple of times for a matter of several minutes before my heart started beating again, and we know that for sure because I was even hooked up to an EKG at one point. But I started looking into filing a lawsuit, and since I am an attorney, and I quickly realized that there's no epidemiological studies, and no attorneys would even take this on because you're talking about probably $1 million of pursuit costs to try to bring a lawsuit like this. And then you have to have some basis to do it. And this is the same trajectory as smoking, since it's very difficult to show with smoking the epidemiological evidence how this actually leads to lung cancer, but now everyone knows it leads to lung cancer. And that's what's going to happen with cell phones, but it's not quite there. So we have to look at the factors that the industry is doing. And I have I had my wife email over my complaint, because I did find a lawyer who had 9 plaintiffs in D.C., which is where I lived. I lived in Georgetown, and he was representing 9 plaintiffs who had been in litigation for about 7 years before I even came to the table, and they still hadn't gone to court. And of those 9 plaintiffs, 6 of them are dead, and I'm like one of 3 that's still alive. And they didn't even get their day in court before they died, and they all left children and everything else. So I started really taken this seriously, and I found out that there's been a series of patents filed, and I'll just give you just an example. So the industry's been filing patents in anticipation of this happening, of this groundswell of evidence and of people actually getting sick.
Patents to make safer phones.
Patents to make safer phones and antennas. And I'm just going to read just a partial part of this. On July 28, 1998, Nokia received a patent for shielding a layer between the antenna and the user to reduce electromagnetic radiation of the user. The application for their patent that they provided to the said the cell phone antenna is a few centimeters from the brain, the hearing organs, and the organs, et cetera, and it has been suggested that the RF radiation induces changes in electrical status, in the ion balance of the nerve cells. A continuous realized exposure to radio frequency has been suggested to weaken the myelin sheaths of cells and eventually lead to impairment of hearing. It has also been suggested that in the worst case can lead to development of malignant tumor, which is what happened to me. I got an anaplastic glioma, an anaplastic astrocytoma, and passed out in the shower. This is 5 years ago, and my heart had stopped. And my wife was pregnant, 8.5 months at that time. We lost the baby. She found me in the shower, and so this has been a series of problems we've had that's impacted our lives severely. And you can see now my mobility and my ability to even function in society is greatly diminished, although I am still mentally sharp, and that's why I'm got all cannons loaded at these guys and using all of my horsepower mentally to take this industry down somehow through my law firm and through my affiliations. So I have a class action lawsuit that I filed I filed with the class action law firm in Canada, and I filed that in Canada because you really can't file class action lawsuits in the United States anymore after the Walmart decision made it so difficult. So I filed it in Canada, and I also have a personal lawsuit going here that's going to eventually grind through courts, but my attorneys are saying it's going to take 2 or 3 more years just to get my case to trial. Hopefully I'll be alive then. No, I will be alive then, but it just shows you how difficult it is to take on, and I'm an attorney, and this is how difficult it's been for me to bring this, just to get it to a court.
Well, I think we all are grateful to you for your courage and for your taking the time.
Thank you.
Now, I'd like to ask Dr. Balassanian to comment on some of the scientific uncertainties, because that's one of the challenges we face. From a scientific point of view, we don't have certainty. And there's a lot of issues here that we need more research on. And then I would invite Frank to lead the discussion with Rene on what are the policy options right now in light of these uncertainties. I think we've heard some of the discussion. There's a lot we don't know. And what, for example, how are we going to get the data on the breast cancer issue?
Well, we've talked about many different. I'm Ron Balassanian. I'm a pathologist at UCSF. I'm an assistant professor in the Department of Pathology, and I also work very closely with the Carol Frank Buck Breast Care Center at UCSF. So we've had very diverse presentations today that have talked about a lot of different potential biological effects, ranging from neuronal development in embryos to spermatogenesis. As a pathologist and cell biologist, I'm not a basic science researcher, but as a clinical pathologist, I could tell you that all of these processes work through different mechanisms in the cell. So the first step would be to try to look at many of the different effects that people are reporting as anecdotal cases and see if there is any underlying connection. Is there a gene or a protein or an ion channel in the cell membrane? All of these have been postulated as possible mechanisms, so it'd be important to see if there's anything that connects all of these diverse processes, or if some of them are just coincidental and could be dropped from the analysis. I think specifically with the case of breast cancer, that's an interesting area for me because it's an area of research that I focus on, but a starting point would be to look at the pathology of all of these cases and see if there is some underlying theme. as Dr. Bailey alluded to during her question session, multifocal breast cancer is not rare. It does occur. It occurs with more frequency now because we are able to detect it more easily with MRIs, and frankly, our pathology is better. In the cases that I have looked at so far, there is a background of in situ breast cancer. So this is breast cancer that's in the ducts and not invasive and may not show up on any imaging. So in those cases, it's actually quite typical to have multifocal invasive breast cancer in a background of in situ. So there are many, many different factors that need to be worked out, I believe, and if there is a biological phenomenon here, finding it is going to take a lot of work and dedication. So it's going to be because of people like Dr. Davis that we're able to do this as a scientific community. I think the worst thing for us to do as scientists is to ignore it, because then we can create more conjecture in the non-scientific community that can create more problems without finding practical solutions to a problem if it does exist, such as safer technologies and better guidelines for use.
Thank you. Brian?
I kind of feel like I'm the bad guy here, but I've spent my career in the technology business. Before I joined Microsoft, I actually spent 14 years at IBM. And there's a mindset in the technology industry that is about looking at the benefits that technology provides and trying to do it better, cheaper, faster. And that's pervasive. It's from the day you start in the organization right through to even no matter what level you're at in the company. I think though that this technology, and I'd say even through history, we were talking about this last night over dinner when we introduced electricity. You know, a few houses burned down because we didn't have, the wiring from 30 years ago wouldn't be allowed today. The seatbelt laws and all those things. So just as a humanity, we introduced the technology and then we kind of let the safety procedures catch up with it. I think, though, that this requires a different approach for a couple of reasons. I think just the speed at which the technology is being accepted, clearly because there's great benefits. Everybody has it. I didn't realize there were more cell phones than toilets, but the numbers are there's 5 billion cell phones in the world, and there's a forecast there's going to be over 50 billion wireless devices in the foreseeable future. By the time you get into never mind smartphones, but smart fridges and smart dishwashers and all that stuff. And of course, they're all using microwave frequencies. I think the second point is that everybody's using them, from young children right through to elderly individuals. And I think the third piece of it is that it's also the amount of harm. There's such a wide range of harm, from people that just have, get rashes if they're electrosensitive, to people who are actually dying from it. And I think for those three reasons, I think it behooves my colleagues in industry to take a completely different approach. I think it behooves the industry now to take responsibility and to invest to understand this a lot better. And I would encourage them, whether it's a fee of so much for each device a month, or we were talking last night, or what about 1% of all the R&D that you spend? And, pass that off to an independent organization and encourage a multi-year commitment so that people are encouraged to do the right thing. But I do think it's like these, I know a lot of these individuals running these high-tech companies, and they're all fathers and mothers the same as I am, and they're all concerned and they want to do the right thing. I just think it takes a mindset that we have to look at this approach different. Government can't catch up on this one. This one is government will always be behind on the implementation of this technology. And I think, and we've witnessed amazing things. I've seen in my career, technology people, if you give them a challenge, they'll figure out a way to do it. And, we're not saying we're not, about no technology. We're about safe technology. And so I think there's an opportunity for the industry to self-impose these guidelines. And I think if there's anything, what I'm trying to do in Canada is getting I met with our industry minister, federal industry, and I said to him, if you challenge industry to do this, they will do it. We've been told by the industry that they could absolutely dial down their cell tower radiation by 10,000 times what the FCC guidelines are. And they sat in a meeting and they said that to us, and still provide complete coverage. They're not going to do it until their competitors do it. So I think, we know we've got the technology. So there's an opportunity for government to challenge industry and motivate and encourage industry to do it. But I also think there's an opportunity for industry to take the initiative. So I don't know if I answered your question, but I'm trying to figure out in my mind how to encourage the industry to because it's now a mature industry. I'd say 20 years ago it wasn't. Now it is a mature industry. There's no excuses. And mature industries look at corporate and social responsibility as a priority, and I think this industry now has the opportunity, and quite frankly, has the responsibility to make this a priority, not just doing things more efficiently for more benefit, but looking at the consequences and then dealing with those consequences.
Rene, can you think of any examples of any industries, that have done the right thing? I'm thinking of the flame retardant story, which has been a long slog. Some of us, worked on, I'm sorry, thank you. I was asking Rene if she can think of any positive examples. And I would ask Mike as well, in terms of lead in gasoline as an example, or flame retardants. Ultimately, industry did the right thing, but unfortunately, it was pretty much when they were dragged kicking and screaming. And is there any example of voluntary stepping up to the plate and doing the right thing? I don't know.
I would say that's certainly few and far between. But I think it's an important point to make, because basically it means that it's up to all of us, right, to really put the pressure on the industry, to put the pressure on government to do the right thing. And in terms of my organization, EWG, Environmental Working Group, I was actually in D.C. last week, literally a week from today, or last week. I'm saying that wrong. And meeting with one of the SEC commissioners and bringing our petition with 26,000 signatures of people from around the country saying that we want better standards, we want better consumer education, and we want better information. And what I mean by better standards is basically standards that will actually protect children, and as you heard earlier, the current standards really do not. Also standards that actually protect people, how they use their phones. So we know that people put their cell phones in their pockets, right? This happens all the time. People put their cell phones in their bras, and we should have standards that protect people so they can use their phone in kind of ordinary ways and not exceed the FCC standard, and the FCC standard itself should be safer. We need better consumer education, so it's not just organizations like EHT and EWG, and it's not just like really progressive governments like San Francisco that are putting out consumer education materials telling people how to use their cell phones safer. We should have the federal government doing the same thing. And we also need, and this is something that we actually haven't talked too much about today, but Susma kind of touched on, is we actually need better data, and not just epidemiological research, which we absolutely need, but actual data on exposure, because we know now that this the one measurement of radiation that we have for cell phones, this SAR value, is not a very good proxy for exposure. And the FCC acknowledges this, the industry acknowledges this, and so one of the things that EVG has been pushing for is, okay, we know this, then we need a better measurement. We need a better proxy that will be measured, and that consumers will be able to get information so they can actually buy a safer cell phone. Right now, it's basically it's almost impossible to do so, because you actually don't know what kind of cell phone is going to expose you to less radiation. And also, something that very few people realize, your cell phone carrier, your network, actually profoundly affects how much radiation you're exposed to. And we have very little information on this. But what we do know is that it's quite distinct, and actually the magnitude of difference is greater than probably what you're getting by using a different phone. So if you buy kind of a quote-unquote lower SAR phone, if you actually switch to a lower radiation network, you're going to be exposed to a lot less radiation than if you just changed phones. So it's a really important area that the federal government is doing very little research on. There's very little information provided to the public.
Which ones are lower?
So I can tell you, so it's tricky because technology has been changing so rapidly. So we had a study that was done a few years ago that showed that certain technologies that underlay, for example, what AT&T was using then, a few years ago, known as GSM, tended to give on average higher radiation versus cell phone companies that used a technology known as CDMA tended to give lower radiation. So what what I could say is that if we could transfer you back in time, it's pretty clear that AT&T would be worse than Verizon. But is that true now is kind of the question, because cell phone technology has changed so rapidly, and we have some research that's been conducted, but it really is kind of an open question. And also with the change to LTE technology, there's also been some early research to show that actually the change to LTE technology is also increasing exposure. But the real point is we need better information, both so consumers can make better informed decisions, and also so we can actually do really good research and be able to answer this question in the long term of whether there is a connection between cell phone radiation exposure. Because right now we just don't have very good measurements, and so it's very difficult to get good data.
What if we were talking about how much alcohol we should give our kindergartners? What if we were talking about how many cigars they should have? I mean, I think some of this discussion can get a little precious a little fast, because it's really, as you say, very confusing, right? We know that in general the GSM technology, which is the dominant technology around the world, is much higher exposure than what is called CDMA on average. And then there are these mitigating circumstances that you referred to. But I think that we're missing the question a little bit here. Concerning the technique of the SAR, Lloyd Morgan and Gandhi and I have published a paper that says there is an alternative technique. It's been certified by the FDA. It's based on actual bodies. You know, it's anatomically based, and they use it to set standards for how exposure can take place inside the body for medical devices. So it's used by the FDA for that, but they don't use it for cell phones. All right, and it's like it doesn't make a lot of sense. I mean, one of the issues that I would invite you all to comment on is we now have a commissioner of the FCC, Thomas Wheeler, who was for 10 years the head of the Cellular Telecommunications Industry Association. That was his job for 10 years. And when he held that job, one of his main achievements was the passage of the 1996 Telecommunications Act that prohibits communities from even raising the issue of health issues with respect to the siting of an antenna. So that man who got those laws passed is now in charge of the FCC. And another thing that he did when he was in charge of the FCC was to lead the studies that were supposed to study cell phone radiation health effects, spent $27 million with George Carlo, and as I document in my book, Disconnect, there was not much that was achieved by that research at all, except to spend $27 million. And when I was a Clinton official, I believed that we were doing the right thing, because we had a joint industry-government study on cell phone radiation. I owned 3 phones. I didn't know anything about it, and I trusted the people around me were telling me the correct information. So how do we deal with, Frank, this situation we have now in the United States? Who do we trust, and where do we go to make things happen? I mean, you're a very unusual guy, all right?
I'll take that as a compliment.
Yes.
I think that the situation in the U.S. is very similar to Canada, and the approach we're taking in Canada is elected officials are the ones you have to get their attention. And, you know, it's hard, and as you go up the food chain of, you know, national officials are harder to get a hold of than the local ones. So we actually get the local ones agitated and get them to put a protocol in place or some kind of a statement that we can then take to the federal folks. But I would encourage you, it's really hard to change policy, but I think you have to focus on the people who are elected. That's what they worry about. They get up in the morning and they worry about getting reelected. That's kind of their primary role. And so so that's what I would encourage you to do, is to, like, some of them have conflicts, and so you have to identify those conflicts and you have to deal with them. But I'd say you have to focus on your elected officials and get their attention and let them know that this is going to be something that you're concerned about, and get them to do the right thing. Like, most elected officials are there because they want to serve the community. I fundamentally believe that. There are the outliers that are dishonest and disrespectful, and you know, just look at our mayor. But so, you know, the world is filled with those kinds of individuals. But the majority of individuals want to do the right thing.
But the process, and Rene I think I agree with you, Rene, completely, that it can't just be politics. And I would even argue this: we don't need any more laws. We've got the laws. Let's just just enforce the ones we have. Brett?
Nothing really changed in the cigarette industry, even though there was multiple lawsuits, until the district attorneys got involved and started suing the states themselves based on recouping health care costs from Medicare, Medi-Cal, and all these types of medical expenses, and states are losing billions of dollars. And so that's, I think that the only thing that's going to change is our lawsuits, because that's the only thing that will get their attention. It's just that simple. Lawsuits will get their attention. That's what happened with asbestos. That's what happened with cigarettes, and this is the third epidemic. And this is more of a pandemic that's going to be across the world if something is not done about it. And so groups like this have to organize and file lawsuits and do epidemiological studies to prove this is going on. Because unless it's proven, they're going to continue making billions of dollars as long as they can without. And the reason why I showed you that patent is that patent shows foreknowledge. Okay, foreknowledge, and which almost brings us to a criminal situation, because I just had a friend 3 weeks ago who died of a glioblastoma brought on by a cell phone. He's now 6 feet under the ground, and if you can establish the fact that these guys had foreknowledge of a dangerous product and they still marketed it and misrepresented the fact, that's beyond fraud and that's beyond civil. That's criminal. Okay, and there's a statute called the RICO statute, which is actually tailor-made to take down the mob, which is kind of a civil and criminal vehicle, that once you can establish premeditation and things like that. So I think that that's where all this is going, and that's what I'm working on personally.
Well, that's very interesting, because as you may know, in the cigarette industry, the RICO statute was ultimately used, and the tobacco industry was convicted of racketeering precisely because it was possible to show a systematic effort on the part of the tobacco industry to anticipate the issues, to manipulate the science, to engage in product defense. So that's why often when we debate this brain cancer story, the debating of the statistics on brain cancer will go on beyond my lifetime. And I'm trained in cancer epidemiology. So I can tell you there are really legitimate questions about it, important ones. But it's the wrong question to be asking. We really should stop saying, do we have enough proof about brain cancer and cell phone use? Because it will take another 20 years to get that proof. But in the meantime, one of the reasons that I was pleased to be able to have Professor Taylor and Professor Kaplan here today is because the prenatal exposures are very compelling. We have many more questions than we'll have a chance to answer, but one of the ones asked for Professor Kaplan and Taylor is, could your findings explain autism? Could your findings have something to do with the growing rate of autism? And I think the answer is, we don't know. But it certainly is important to ask. And the question isn't being asked when you're as a doctor, when you have a patient with autism, that ought to be the question you ask. How much use did the father or the mother make of the cell phone? That's an important question we're not asking. For breast cancer, we simply want to get a question asked on the intake for young cases of breast cancer, and for all, for that matter, where did you keep your cell phone? We need to start with getting that information. What about a boycott? What would happen if we got our act together and identified the worst actors, the hottest phones, and said to this industry, we want you to make your phones less hot? Well, what would that do? I mean, is the industry, it's just so huge and powerful that that's not worth trying?
See, I think that we just don't have the data to actually do that. And I think one of the powers of getting the data that actually tells us which phones are higher exposure than others and which networks are higher exposure than others is that then we can actually have the market compete. And we can actually see the cell phone industry realizing that there are a lot of people who care about this issue, and there are people who want to buy lower radiation phones and want to actually have lower radiation networks out of precaution. So I think that's that kind of missing piece. That's why it's one of our greatest calls.
All right, Sushma, what's next for the city? We had a retreat that you led on the precautionary principle. It was the 10th anniversary. Earlier, Mark Leno was here. I don't know if you saw him, and we're talking with him about what can be done next. And I think the bully pulpit, those who can hold hearings and can bring people out in the public, to give people like Brett, and I see here we have the Marks family here, and I cannot tell you I would not be here today if it weren't for Ellie and Alan Marks, and they have done an amazing job of speaking out, and I want to thank them. And their son Zach is here, and they, like Brett, have refused to just go away quietly on their own, and they are speaking out and trying to get more public attention to this because they don't want other people to go through the challenges that their family face every day. And the good news is that Alan is doing great. We're very happy. But it's, you know, it's a hell of a thing to have to deal with. And I know that it's been an enormous challenge for you. And we're all very grateful. And we have information. We have information on our website about this, and I was asked if you want to make a donation for lunch or if you want to buy my book, by the way. I'm not good at this. You can buy holiday presents, 1 for $15, 2 for $25, and 3 for $30. So give it to anybody whose brains you care about. And our website is environmentalhealthtrust.org or ehtrust.org. But I think we have, what I will promise is this, before the end of the year, we will put all the questions that we received up on the website of either the Commonwealth Club or ours, and we will answer them. So that we will start this process of answering the questions. I'm volunteering Dr. Moskowitz, Lloyd Morgan, and others to help me to do this, and we will give you answers to every question that we've received. And I would invite you to submit questions through the Facebook page for Environmental Health Trust, or any of the other social media things that Joel Moskowitz and I are running, which we don't fully understand anyhow. But we would love to get your engagement and really create more of a dialogue. Environmental Working Group has terrific information as well, and we hopefully we'll be able to work together to work on this and other issues, because it is only by doing that together that we'll be able to make more of an impact. Frank, I would ask if you think, have you had any encouragement from colleagues in industry? Because you're quite an outlier.
No, I haven't. No, it's interesting, the reaction, because when I have a chance to talk to people in the industry, and I say, look, I'm not saying it's to not use this technology, I'm just saying use it safer. You can't, it's pretty hard to argue with that. But I haven't seen anybody yet that say, yeah, you know what, we should take the lead. It's not there yet, unfortunately, and I've talked to many, many people. It's, you know, if the government pushes us, or if there's a competitive advantage, I'll do it, but I haven't seen the switch flip yet in anybody that I've talked to where just do it because it's the right thing to do, and the benefits will come. I haven't seen that yet, unfortunately.
Well, I think I should at least take one or two more questions from here before we conclude, and then I have one final words for you. While Dr. Lazinski notes that they're generally negative animal studies, could you please comment on the blood-brain barrier effects and the Fry effects? And the answer is, the reason they're generally negative studies, in part, is because industry sponsors a lot more research than is done independently. And when you evaluate studies in terms of who paid for them, the studies that find no problem are disproportionately funded by industry. And the studies that find a problem are disproportionately independent, and there are fewer of them. So if you simply weigh them, if you do a superficial review of the evidence, of course it's inconsistent, but that's by design. It's by design, and that's part of the problem that we're dealing with. One question was, can you say more about digital dementia? Does it impact adults as well as children? Is it reversible? Well, one of the things we've learned about the brain is it's very plastic. We've learned that, contrary to what I thought, years ago, I'm not doomed yet. We still can train our brain. We can learn things. Our capacity to repair brain damage is considerable. And again, it's one of these things we need more research on. We have a very simple research protocol that we can develop, looking at cell phone use and taking saliva to analyze what's in that saliva. And we're ready to do it. We're trying to work with Darius and others. There are some simple questions that you can't answer, and the effects on the brain, I think if you're having, there are some effects, and we have not been able to characterize them. Again, it's this question Dr. Balassanian points out. We simply haven't been asking those questions, and we need to. Joe, you had some questions about Wi-Fi in schools, and I wanted to ask you if you wanted to comment on it here. Here, you can take a mic right here. All right, okay.
We do have concerns about Wi-Fi in schools. And in fact, the Los Angeles Unified School District, which adopted $1 billion technology plan using school bond money and is devoting most of it to putting Wi-Fi in the schools and giving every child an iPad, a wireless device. When this came up before the school board, numerous experts around the world submitted written documentation arguing against this, the wisdom of this decision. The school board ignored all of it. I have summaries of those submissions on my website, saferemr.com, so you can take a look at what various experts from around the world have had to say about this issue. But clearly there's a need for precaution here, and we should not jump full speed ahead into putting Wi-Fi in every school in the country. This is a really bad policy decision. We can wire the schools and provide internet.
Talk about the Israelis' advice on this. The Israeli advice about Wi-Fi in school.
Well, the Israelis sort of advise against it and then go ahead and do it. So there's a lot of hypocrisy within various governments, not just our own, or ignorance or denial. We're not alone here by any means. This is a very powerful industry. In the U.S. alone, we spend $180 billion a year on just cell phone minutes, and government collects $30 billion a year in taxes and fees. So we're talking about a lot of money at stake, an important part of the economy, one of the most profitable and growing parts of the economy, and they have an enormous amount of political power, this industry. The CTIA representative has bragged, basically, and we have it on tape, that CTIA meets with the FCC 500 times a year. We maybe get one meeting a year. I don't know if you've got any. All right, 2 meetings a year. So you can see what the stakes are here in terms of political clout.
I've been asked to tell you that the EMR Policy Network did a study on antennas. They actually went out and measured what was coming out of antennas, and they found much higher intensity of microwave radiation from antennas than is legal. And we have many reports of this, that there are antennas that exceed what is considered legal, and there's no routine monitoring. The last time the United States of America monitored radiation, microwave radiation, across the country was 1980. 1980, all right? So now I would invite Frank, if you have any closing remarks you want to make.
I think this can be a little bit overwhelming. And so the one point I would make, the one comment I would make, especially for children, is that the thing you can control to a certain degree is your home environment. So, you know, rest assured that that kids particularly are little machines when it comes to reacting to a safe environment. So I would really encourage you, the first step you should take is make sure your home is protected for night. So go to Home Depot and buy timers and put your Wi-Fi on a timer if you can't get rid of it. Throw the portable phones out. Make sure there's nobody sleeping near a cell phone. Put them all in one room and turn them off. If you have a smart meter, make sure that it's away from an area where people are spending a lot of time. And if you have a baby monitor, you know anybody who has one, throw it away. Don't even give it away. If you do that piece of it, then I think you're creating a safe haven for the body to rest and recuperate and repair. Then you can start doing some of these other things. So start at home, start with protecting yourselves, and then that's the voluntary part. And then work with organizations like these organizations here to influence policy so you can impact the involuntary radiation that you're subjected to.
And I would add to that we've got some handouts here that I would invite you to take only if you agree to give them to other people and recycle them. These are cards that tell you how to practice safe phone. And EWG has other information. Joel Moskowitz, your website is?
Saferemr.com.
Right.
SAFEREMR.
Okay. And Rene, it's really a pleasure to be with you today, and I want to leave you with an African proverb that I think is relevant for all of us. If you want to go fast, go alone. If you want to go far, go together. And I think we will go far together, and I thank all of you for joining us today.